Movement with needles. Acupuncture's next generation trigger point technique. Video table of contents, Korean Kinetic Acupuncture, Movement with Needles, a 6-hour class in 3 videos of approximately 2 hours apiece. Video 1, Introduction to Samra Acupuncture Center, beginning at 6 minutes 12 seconds. Dr. Choi, Progression Analysis Chart at 19 minutes 29 seconds. Pain and the 8 Mechanisms of Trigger Points, introducing Dr. Jonghwa Lee. VST Acupuncture section begins at 56 minutes and 48 cents. We have Agonist, Antagonist muscle discussion, introducing neck and shoulder vertex of VST and lower back and hip vertex. And then the detailed neck and shoulder vertex chapter begins at 1 hour, 9 minutes and 30 seconds. The detailed lower back and hip vertex begins at 1 hour, 30 minutes and 26 seconds. We have a range of motion testing of the vertexes at 1 hour, 30 minutes and 26 cents. Muscle twitch response, the trigger point muscle twitch response begins at 1 hour, 37 minutes and 53 seconds. And the VST acupuncture demonstrated in clinical trial, which includes acupuncture needling, is at 1 hour and 44 minutes. Video 2 begins with kinetic acupuncture and introducing Dr. Hyung-Suk Choi, introducing isometric stretching techniques, the treatment plan triangle, and then we begin the wrist, hands, and fingers demonstration or chapter with video demonstration techniques at 42 minutes and 23 seconds and the fountain of youth stretching procedures at 51 minutes. We have elbow chapter beginning at 54 minutes, and there's a video demonstration of golfers and tennis elbow. Triceps begins at 1 hour, 13 minutes and 42 seconds with video demonstration and fountain of youth stretching. We have a VST refresher for neck and shoulder because that's a prelude to the kinetic shoulder. So Korean kinetic shoulder chapter begins at 1 hour, 27 minutes and 44 seconds. We show therapeutic cervical technique demonstration chapter, TCT, 1 hour, 35 minutes. And then we have the shoulder demonstration with some stretching. Video 3 begins with calf muscle for treatment of plantar fasciitis, Achilles tendonitis, bottom of the foot pain, and pathology. We have the video demonstrations. There's 3 of them, which begin at 17 minutes. Then we have the anterior tibialis for top of the foot pain and pathology, beginning at 34 minutes, with video demonstration at 45 minutes. We have the knee chapter beginning at 52 minutes. The hip IT band beginning at 1 minute and 1 hour 6 minutes. Piriformis syndrome chapter beginning at 1 hour 14 minutes. We have a TLT therapeutic lumbar technique, which is an acupuncture in the quadratus lumborum, followed by a back stretch chapter and video demonstration beginning at 1 hour 30 minutes. And then we do the lower back pain and hanging lower back stretch, which begins at 1 hour 39 minutes and 30 seconds, followed by psoas muscle, fountain of youth stretching, and video demonstrations. Korean traditional and modern medicine. Im, from 1570 to 1647. Heoim is the father of trigger point acupuncture, followed by Dr. Jun Shuk Shin, the contemporary doctor of the famous Jaseng Hospital in Korea, and by Dr. Hyung Suk Choi, creator of Kinetic Acupuncture, and Dr. Jonghwa Lee, creator of VST, Vertex Synchronizing Technique, Trigger Point Acupuncture. From Heoim's book series, The Dongwe Bogum, this is his technique from Heoim. In case muscles of hands and feet were spasmodic and immobile, he inserted 4 to 5 round needles at the muscles and let others forcefully stretch crooked joint and flex stiffened joint. Heoim from 1570 to 1647, the father of trigger point acupuncture. Hello, I am Dr. Evan Mahoney, Doctor of Acupuncture and Oriental Medicine. This video series is on Korean Kinetic Acupuncture featuring VST, Vertex Synchronizing Technique, and Kinetic Acupuncture for the treatment of muscular tendon pain, pathology, and dysfunction. The materials of this video series are based on the books Korean Kinetic Acupuncture and Sa'am Medical Meditation, as well as my other books, VST, Capstone and Credentials, and my stretching series, Dr. Evan Mahoney, Fountain of Youth Stretching, and Eliminate Back Pain, Hang from a Tree. These books are available at Amazon.com. This video featuring Korean Kinetic Acupuncture using the VST and Kinetic Acupuncture treatments will focus on the treatment of musculotendon pain affecting the fingers, hands, wrists, elbows, shoulders, neck, lower back, hips, groin, knees, ankles, feet, and toes for conditions such as tendinitis, peripheral nerve impingements, arthritis, sprains, strains, tears, trigger finger carpal tunnel syndrome, golfers and tennis elbow, rotator cuff injuries, neck pain, lower back pain, sciatica, piriformis syndrome, psoas muscle, hamstring, knee pain, calf muscle, plantar fasciitis, radiculopathy, neuropathy of the hands and feet, plantar fasciitis, Achilles tendonitis, and more. So I'm Dr. Evan Mahoney. I got my doctorate in 2011 after completing my doctorate program, which I was working under scholarship as well as studying from 2009 through 2011. I worked at Samra Acupuncture Center in Los Angeles. This was an extension, their doctorate program was an extension of the master's program, which in 2008 I completed my master's in acupuncture and oriental medicine. I soon got accepted into their doctoral program where I worked full-time in their pain management clinic, and I studied firsthand personally under Dr. Hyung Suk Choi here, and also he's the creator of Kinetic Acupuncture, and I also studied under Dr. Jonghwa Lee, creator of VST Acupuncture. And the VST acupuncture was the subject of my capstone presentation, which there will be a video series included in this video, which shows the clinical study that we did. And during this clinical study, you'll see nice range of motion, agonist, antagonist muscle identification with the acupuncture, range of motion performance, and we measured before and after the treatment. And we studied the neck and lower back vertexes with VST. So we'll be covering that in this video. And as far as this brochure, Dr. Choi and I published this brochure back in about 2009. So I'm going to read through just what we have written. And so Samra Acupuncture Center. Acupuncture is a well-known and effective treatment for pain control. At Samra Acupuncture Center, we specialize in the treatment of back pain, neck pain, and a wide range of difficult to treat musculoskeletal diseases such as ruptured or degenerative discs. We also provide care for patients who suffer from fibromyalgia, complex regional pain syndrome, and paralysis from stroke. Samra Acupuncture Center is integrating a 2,000-year-old discipline with today's medical advancements using the best practices from Western and Eastern medicine. We have an MRI and digital X-ray imaging center on site to help determine the exact diagnosis and prognosis of our patients' ailments. Our main treatment is acupuncture, but we also work with a radiologist, pain specialist, who are medical doctors, and a chiropractor. All treatments are approached in a comprehensive way. After evaluating the patient's condition, we can help educate them about their options for care, including surgical referral if necessary. Our mission is to bring the most effective, results-oriented healthcare to our patients in a friendly and pleasant manner. On the following page, you'll see the biographies. Our world-class doctors make the difference, bringing the best in acupuncture to America. Samra Clinic offers specialized acupuncture services based on years of scientific research and experience. Our physicians and specialists are leaders in their fields. The training of acupuncturists in Korea is quite rigorous, requiring years of academic study, internship, and residency. In fact, Korean Oriental medical schools are as selective and competitive to enter as conventional medical schools. Our doctors are at the top of their class and profession. And you'll see the biography of Hyung-Suk Choi, who is the CEO of Samra Acupuncture Center. He at that time was a professor of Oriental medicine at Samra University. And by the way, currently he is teaching the doctor's DAM program at Dongguk University, located on, I want to say, Wilshire Boulevard in close to downtown Los Angeles. Dr. Choi has a wide experience working in the best clinics and hospitals in Korea. Graduated at Kyunghee University, which is the very competitive acupuncture school there. He did research and all kinds of research on many subjects in many schools. On the next and following page, you'll see the employees of Samra Acupuncture, and at the top is me. And I was a resident doctor at that time, and I completed my doctoral program. I finished it at Emperor's College because our school actually declared bankruptcy about a year and a half into the program. And I completed my capstone and doctoral program at Emperor's College in Los Angeles for the last 6 months of my program. Inside Samra Acupuncture Center. At Samra Acupuncture Center, we take a 21st century approach to a 2,000-year-old discipline to provide our patients with the best of modern technology and age-old wisdom. We use contemporary diagnostic tools, an MRI imaging center, which was an investment of $500,000. And we had the full MRI imaging center. I got to practice at the controls of it, as well as be a guinea pig, where I got diagnosed with my L4, L5, 8-millimeter bulging disc, which caused me excruciating pain at the time. That was my introduction into the pain management clinic. At that time in 2008, I had my first bout of severe lower back pain with sciatica down the leg. And so I was both a patient and practitioner, sympathizing greatly with the patients who were undergoing the same kind of pain that I was going through. So Dr. Choi and I, we named the technique Mobility Plus Acupuncture, and we highlighted a kinetic acupuncture technique for lower back pain. And it was a march that we did around the clinic where we would put acupuncture points in the lumbar area of Do4, as well as on large intestine 11 and stomach 36, and also Do16 on the spine and we would have them do a march around the clinic. This was the last thing we did. We did a series of other treatments. During the treatment, we did different steps in the treatment. We do acupuncture, we do stretching, and this was basically the last of the techniques in a treatment. And there would be two practitioners, myself and another, that lift the patient from under the arms and shoulders, lift them up, and they'd march around the clinic. And so we'd say, keep your arms swinging. 1, 2, 1, 2, 1, 2, leads the instructor as a young man performs what appears to be a formal and vigorous military march. This man is not in training for the army. He is being treated for back pain. If you look closely, you can see that he has barely visible acupuncture needles in his arms and legs. This is part of Samra Acupuncture Center's Mobility Plus Acupuncture. This unique treatment of needles and movement has helped alleviate severe and acute pain in many of our patients. Most patients experience immediate and extreme relief. So, our treatments deliver pain relief, optimal function, and balanced structure. The structure balancing of straightening the spine with passive and active movements. The concept behind mobility plus acupuncture. The body has both structure yin and function yang. They are two sides of a coin. The human body should be treated as a whole, encompassing both aspects. Structure. The spine is like a mast on a sailboat. In order for the mast to be stable and upright, it must be sustained by many ropes. When we treat a patient's back pain, we do not work directly on the spine, mast being the spine is the mast, but rather on the muscles, the ropes that attach to it and are giving tension to the mast. By using acupuncture, we can balance the tension of muscles and eventually obtain proper stance of the spine. So function, in order to promote optimal function, we induce passive and active movements while needles are in place. Needles act to clear and dredge the blockages that can occur in muscles, joints, or nerves. Active motion with needles in place improves circulation of blood and oxygen to the area. This in turn helps improve lubrication between tissues and promote healing. Patients walk with needles or perform special workouts designed for their individual injury. In conventional acupuncture, the needles are inserted and the patient remains static. Mobility plus acupuncture treats the human body as a dynamic, moving entity. Common pains treated by mobility plus acupuncture. The doctors at Samra Acupuncture use mobility plus acupuncture for a wide variety of symptoms. In the treatment of lower back, shoulder, elbow, wrist, or knee pain, the doctor will induce passive and active movements while the needles are in place. This allows the doctor to stimulate the end of the joint cavity and all the muscles attached to the joint. Frozen shoulder patients who couldn't move their arms have been able to get dressed, lift their arms, and touch the opposite ear after just a few treatments. So we treated spine-related disorders, lower back, neck pain, sciatic disc problems, post-surgical pain, musculoskeletal pain, acute chronic pain, unresponsive to other treatments like PT, chiropractor, injections, and so forth. And fibromyalgia, chronic fatigue syndrome, complex regional pain, frozen shoulder impingement syndromes, nerve impingement, peripheral nerve impingements, knee pain, knee complaints. So this was my experience for a year and a half working full-time in the pain management clinic. And we had 3 chief practitioners in our one location, and Dr. Jonghwa Lee was a chief practitioner in another location in Irvine. This was in Los Angeles, close to downtown, just a half a mile from Staples Center on Olympic Boulevard. And so we had 3 chief practitioners. We would treat upwards of 100 patients per day. And that was my experience. I worked full-time in the pain management clinic, and then I went to classes at night for my doctoral program. And the subject of my doctoral program capstone was again on VST Acupuncture, Dr. Jonghwa Lee's VST, which you'll see the videos coming up soon. But I practiced Dr. Choi's Kinetic Acupuncture and Dr. Lee's VST all the time in the clinic. Whenever somebody comes to me for pain, I'm using Korean Kinetic Acupuncture, VST and Kinetic Acupuncture. This is pain. In my previous video on Samra Acupuncture, we talked about everything else except for muscle tendon pain, because when they come to my clinic for muscle tendon pain, I'm going to these techniques. So we get really good results, and we're going to give you some more guidance here in just a moment. These are books by Doctors Hyung-Suk Choi and Sung Choi, available on Amazon. Dr. Choi has the Kinetic Acupuncture book. It's acupuncture with movement, kinetic acupuncture. Easily mastering special test and orthopedic examination, orthopedic test made easy. And his wife, Dr. Sung Choi, has Myung Chim facial cosmetic acupuncture, and then also a book on acupuncture and moxibustion, as well as a basic acupuncture techniques and photographic guidebook. So these are books on kinetic acupuncture and others by Drs. Hyung-Suk Choi and Sung Choi, available on Amazon. Okay, welcome to the Choi progression analysis chart. This is a chart I created, but it's named after Dr. Hyung-Suk Choi, who taught me this. And it's a prognosis model based on the expectations, based on the techniques of VST acupuncture and kinetic acupuncture. And the model is the prognosis, to make an effective prognosis for the patient. And this is something I do with every new patient. I make a prognosis based on this chart. And with the techniques of VST and kinetic acupuncture, most of the prognoses are favorable. That means I'm expecting results quite often. I'm expecting results on the first treatment with the techniques that we do. Now, we have to work our tails off sometimes to get that prognosis, to meet the prognosis. But I believe when I make a prognosis, I believe I can meet it. And this is on new patients before you even start the treatment. And Dr. Choi had taught us that if you can make a prognosis, it will really increase the respect that the patient has for you, and the reputation and the confidence that the patient has in you if you make the prognosis and you meet the prognosis. And many times, with these techniques, you'll kind of, well, all the time, the patients will be very surprised. I tell them, I expect to get a good result for you today. And they're like, what? Really? Because they've been through so much. And so, with the techniques of VST and kinetic acupuncture and using the Choi progression analysis chart, this is how we make our prognosis. Now, this chart pertains to muscular tendon pain complaints, with some other things like degenerative disc diseases and so forth. But for muscle tendon pain complaint, this is the Choi progression analysis chart. So the first thing you'll see is on the horizontal line, it's duration of complaint. And in the middle of the graph, you'll see on the left side, the duration of the complaint is acute or subacute, which is pain that is up to 6 months old. And then to the right of that is the chronic condition where the pain has been there over 6 months. So that's the horizontal line. And then you will see on the vertical line, intensity of pain. And you'll see, is the pain getting worse down on the bottom there? And then is the pain getting better? So that puts us in category A. And category A is the most favorable prognosis. This is the acute stage. It's under 6 months, and the pain is already getting better by the time the patient has come to you. So this is the most positive of prognosis. This generally refers to muscle strains, sprains with sudden onset. The patient was lifting or twisting something when they got a sudden or sharp pain. Therapy should be, I would say the prognosis should be met between 1 to 3 times within 2 weeks before the problem is solved. Now, nowadays, I tell the patient, I'm going to get you better on this treatment, the muscle sprain, strain, the recent pain, it's already getting better. and you've established its muscle tendon pathology, expect good results on the first treatment. And again, you may have to work your tail off for it, but that's what we do. That's the service that we provide for our patients, and that's the reputation that we have with our patients. So, I mean, category the prognosis I call celebrate. Victory is near. So, especially like cases of piriformis syndrome, which is a form of peripheral nerve impingement, but it's a form of muscle shortening we'll get to shortly. But this piriformis syndrome is they patients may have been to many other doctors and they don't get relief. They may have an injections and so forth. And then they come to you and I'm telling them I expect to get a good result on the first treatment, and their minds are really blown away. And then you deliver the results. You'll get results on that first treatment, and they're just totally impressed with you, and they have confidence in you, and your reputation is established. So make the prognosis and have confidence in your abilities and skills. Okay, so category B is chronic. This is a condition that his pain condition that's been over 6 months, but the pain is getting better. This can cautiously be considered a positive prognosis. This generally refers to the end stage of lower back disc-related problems. Disc problems should resolve themselves spontaneously within 6 months. And going back, generally with a muscle sprain or strain, the prognosis in general is 3 weeks. Muscle sprains should resolve themselves within 3 weeks. Of course, with that treatment, we'll get them on that first treatment. This one, so this is generally refers to end-stage disc problem. Disc problems can resolve themselves spontaneously within 6 months. Patient can resume normal function, clearing the heat of the inflammation of the pinched nerve, and the rebuilding of channel connections makes for a longer-term therapy, 10 to 15 times within 2 months. Now, again, actually, when the patient's getting better and they come with a lower back pain and there's no sciatic at the time, this with the techniques that we do, and you'll see the kinetic lower back with the hanging back decompression stretch and the stretches that we do. This actually is also a very favorable prognosis, and I'm giving the prognosis of expecting a good treatment on this first treatment. Again, there's no active, stubborn kind of sciatic symptoms, which will differentiate with piriformis sciatica. The pinched nerve is definitely more complicated than the piriformis type sciatica. So in this case, there's no current pinched nerve sciatica. It's just a generalized lower back pain, getting better. Expect good results with the first treatment with the techniques of VST and kinetic acupuncture. Okay, so category C, it's what are we dealing with here? It's the acute stage of new pain and getting worse. It's pretty severe, pretty bad. So this is a diagnosis is essential for this category. We need to rule out between a sprain, strain, disc problem, tumor, arthritis, or another problem. The patient intake and examination shall lead to the diagnosis. Further confirmation by MRI or X-ray may be helpful. This diagnosis will determine the therapeutic plan. If it is a sprain or strain, and sprain or strains can be very severe pain just as much as a nerve-related issue. So it sounds benign. Oh, you just got a muscle sprain or strain, but it's severe pain for many people. So with muscle sprains or strains, if you determine the patient was lifting yesterday and they just got the severe pain and it's getting worse today, but you determine it's a muscle sprain or strain, expect a good result on this first treatment. If they had some kind of fall or traumatic accident, and you know what's going on, is there a muscle tear there, a tendon tear, ligament tear? Is there a broken bone? So there's some mystery going on here. A lot of times I'll do the first treatment, and if there's no results, and I refer out. If the pain is just as bad, there's no results, or it gets worse, I'm referring out to an MRI or X-ray or another doctor. If we're not getting good results in that first treatment, I want to know like what's going on, and another doctor or MRI will have to determine that. The category D, this is the chronic stage. The pain has been for 6 months or more, and it's getting worse. Now, this generally applies to disc patients. This actually applies to patients with multiple episodes of history of pain. In regards to back pain, it could be spinal stenosis, surgeries, multiple surgeries. Arthritis is not a big deal, actually. Arthritis, I put this in the very favorable category because I expect good results even with arthritis and some stretching. But this is the poorest of prognosis and is difficult to treat. Nonetheless, we can still get good results because they've never had these techniques done before. So I expect even good results a lot of times in these category D patients. Yeah, this will require long-term therapy over 20 times for up to 6 months. But you know, it's possible the patient may achieve only minimal temporary results or relapse after improvement. But once again, so yeah, they've come to you with a long litany of history of years or surgeries and health woes and all kinds of therapies. So nonetheless, they may have never done what we do. And so you get the good result on the first treatment. You can still, if you feel like you can get a good result on that first treatment, do it. Now, you can prepare the patient, and I tell them, well, this is a complicated prognosis. We'll do the best we can, and I think we can help, but it is a complicated prognosis, and we're going to do the best we can. And then you wait and see after the treatment, how do they respond after that treatment? Do they feel better? Oh, well, that's great. That's very favorable. So if they feel better, as long as they feel favorable, and then, now the question is, how long do they feel good for? Is it just a matter of minutes, hours, days, weeks? I generally say if a patient feels good above and beyond 5 or 6 days, that's going to become the new normal for them. That's the expectation with what we've taught them, the stretching and the exercises and what we do for them. So even these category D patients, can get good results, and it can be very favorable. So hopefully with these techniques if you can incorporate them, and you'll get good results on the first treatment. Yes, you may have to work your tail off, and you'll see when we do the treatment triangle, there's many, there's steps, there's a category, progression of steps that we do for each condition, and sometimes we're doing multiple stretches, multiple techniques for one condition. But it's all to get the best result on the first treatment. That's my own personal philosophy. I want to do the best as I can, get the best result as quick as possible. And when you do, I mean, it's going to make your reputation. They're going to refer you to you. They're going to really highly regard you and have a lot of confidence in you. So it all starts with making the prognosis at the patient intake before you even start the treatment. And so this is what Dr. Choi taught me, and I love it. I use it, and he told me it would establish my reputation and confidence of patients in me, and he's absolutely correct. Pain and the 8 mechanisms of a muscle trigger point. This is in Korean Kinetic Acupuncture book. So trigger points are knots or nodules located in muscle tissue. The first mechanism that occurs due to the presence of knots in the muscle tissue is that the muscle becomes shortened. The analogy is if you take a piece of rope and tie a knot into it, it will shorten the length of that rope. Knots, trigger points, are clusters of fascia which tangle up and shorten the length of the muscle. The second mechanism that occurs due to trigger points is that they add increased tension and strain on the tendons. If the muscle is shortened, it adds more strain on the tendon. A stretched and tightened tendon will likely rub with increased friction against adjacent tissues. Tendinitis is inflammation of the tendon, and muscle strain sprains are the most common injuries and diagnoses resulting from shortened muscles. The third mechanism that occurs due to the presence of trigger points is the range of motion of the joint or limb will be decreased. The pull and strain from the shortened muscle and tightened tendon simply will not allow full range of motion of the joint or limb. When we do accidentally twist our foot or limb beyond its inhibited range of motion, a muscle sprain or strain will occur. Further damage, such as a tear, can also occur. Fourth mechanism that occurs due to the presence of trigger points is that they inhibit the circulation of blood and oxygen to the muscle tissue. blood and oxygen have a harder time circulating through the cluster of knotted tissue and fascia. The muscle becomes dehydrated. Dr. Hung-Suk Choi of Samra Acupuncture Center and now Dongguk University states that the muscle tissue becomes like a beef jerky-like consistency, very dry and stringy with inhibited blood circulation. The fifth mechanism of a muscle that is dry and stringy with trigger points is that it's unable to be strengthened. The theory is that you must stretch the muscle first to strengthen. You must restore it to its normal length, tenderness, and pliability first before resuming strengthening. Sixth mechanism, the trigger point is painful upon palpation. The pain felt does not have to be local to the trigger point area. Pain will refer to points where the muscle attaches and inserts. Many painful diseases are actually located distally away from where the trigger point occurs. Now, this is a form of diagnosis. The diagnosis of a trigger point is pain on palpation. You press on a muscle area, ow, that hurts. The ashi point, okay, that's diagnosed as a trigger point. That's how you diagnose this, pain on palpation, the ashi point. Seventh mechanism is that trigger points can be present without any pain or physical complaint until a triggering event occurs, like an accident, injury, or exposure to cold and ice. There may be no physical complaint even though the trigger point is present. The eighth and final mechanism is that peripheral nerve impingement. A shortened muscle, stretched tendon, may pinch on the nerves at the periphery outside of the spinal column, causing radiating pain, numbness, or tingling down the arms or legs or joints. This is a more favorable prognosis as muscle stretch and tendon relaxation will eliminate the nerve impingement. And this is the piriformis syndrome, where the piriformis muscle is impinging on the sciatic nerve, but we also get this going down the shoulder with the rotator cuff muscles. Cold. Muscle trigger points may lie dormant and be asymptomatic until a triggering event occurs, such as accident, muscle strain from heavy lifting, or falling. In acupuncture medicine, cold is also a major factor behind the cause of pain. In general, cold triggers pain because it causes the muscle to contract and blood vessels to constrict. This exacerbates a muscle already shortened from trigger points and already restricted blood circulation. In regards to a patient's history, when the cause of pain is a mystery and the onset is unclear, look to cold as the source and chief suspect behind the pain. And we highlight 5 exposure points to cold to our patients. Number 1 is food and drink, drinking ice cold drinks, eating raw fruits, foods, vegetables, energetic cold foods, smoothies, so forth. Swimming in cold water, air conditioning drafts on the back of the neck, sleeping under an open window, which can trigger Bell's palsy, air conditioning in the car, office, home. There can be cold harboring in the body from being in a cold environment. There can be traumatic episodes like PTSD can trigger cold in the body and make us susceptible to cold. We may underdress in the wintertime and be underdressed, and we may walk barefoot on a cold floor. And the cold can transmit from the feet to the legs to the lower back. So the cold can be the triggering event of pain, and just be on the lookout for any kind of cold feet for back pain or exposure points to cold, air conditioning for neck pain. Okay, so I just want to kind of repeat verbatim what I tell my patients, and I've told my patients over thousands of times. I kind of have this speech down pretty well, but it just repeats some of the major points on the mechanisms of trigger points in the muscle. So I usually begin by asking the patient if they've ever had a massage, and if the massage therapist ever says, "Oh, you've got knots in your muscles." Well, the analogy of a knot in a muscle is if you take a piece of rope and tie a knot into it, it will shorten the length of the rope. So if my biceps muscle has knots, these knots are tangled up muscle tissue and fiber. They bunch up and tangle up in the muscle and shorten the length of the muscle. Then begins a few processes. The first is that the tendon, which attaches the muscle to the bone, is more stretched. So the muscle's short, the tendon is more stretched. This stretched tendon will rub against adjacent tissues, causing localized pain, inflammation, swelling. That would be a tendonitis diagnosis. Over the long course of time, the stretched tendon can pull the joints out of alignment, which will lead to the development of bone-on-bone arthritic conditions. Furthermore, the short muscle will restrict our range of motion. Right now, I can fully extend my arm, but if my biceps was short with knots, maybe I can only go this far. And if I have an accident and I go beyond that, that becomes a muscle sprain or strain, which is a micro or macro tear of the muscle or tendon. Furthermore, in the case of peripheral nerve impingements, which is piriformis syndrome, but also a lot of shoulder issues coming from the infraspinatus, teres major, or triceps muscle, can cause a radiating pain going down the back of the arm to the fingers. That's a peripheral nerve impingement. So, furthermore, a short muscle or stretched tendon can pinch on the nerve, and that can cause the radiating numbness or tingling sensations going down the arm or the leg. So in those cases, it's peripheral nerve impingement, and when we recognize it, we expect to get relief for the patient on that first treatment. Now, on the subject of cold, I always remind them that cold can constrict the muscle. Cold can be the triggering event of pain. And so we want to guard and caution the patient about exposing themselves to cold vis-a-vis air conditioning drafts, ice cold drinks, being underdressed in the winter, walking barefoot, and also sleeping at night, tossing the blankets off. So you kind of want to explore that. And also, I always ask my patients, do they easily get cold hands and feet when the weather turns cold? When they answer yes to that question, then we advise them to be very guarded and protective about bringing cold to their body because it can precipitate pain. Now, an explanation of what we want to do about these knots. With acupuncture, we want to go into those knots to untie them out of the muscle, to relax the muscle, lengthen the muscle, and stretch the muscle to relax the tendon. The tendon can be like a stretched rubber band where it's going to rub against adjacent tissue, pinch on nerves, but we want to stretch the muscle to relax the tendon like a loose rubber band so it's not rubbing and pinching against the nerve. So we essentially want to untie those knots with the acupuncture and stretch the muscle. The theme of our treatment is actually stretching and warmth. We love warmth for stretching. The warm water in the hot tub or jacuzzi softens the muscles and you can get the best stretching done. So we can accomplish the muscle stretching with acupuncture by doing passive acupuncture, trigger point release, VST acupuncture, which we'll be talking about, or we do it with kinetic acupuncture, which is movement of joint or limb with acupuncture needles in place. Dr. Jonghwa Lee is the founder of VST Acupuncture, Vertex Synchronizing Technique. You can find him at the website www.acupia.com. He has a clinic in Irvine, California, and many in Korea. This is his biography from his website, acupia.com. Dr. Jonghwa Lee, PhD, licensed acupuncture, Korean medical doctor, pain management, VST acupuncture, reset detox, functional medicine. Dr. Jonghwa Lee is an internationally distinguished expert in the field of Korean medicine. His contribution and commitment to the field of Korean medicine in the last 25 years has been tremendous. Today, he is renowned for his publication, lectures, patent, and foremost experience in the field. He began his studies in Korean medicine in 1990 at Kyunghee University in Seoul, South Korea, and received his Bachelor of Science and Master of Science and PhD degrees from Kyunghee University. After graduating, he devoted several years research biochemical mechanisms of metabolic diseases such as diabetes and obesity, and their interaction with herbal ingredients. Um, and then at Kyunghee University Medical School's Molecular Biological Lab. During this time, he began developing his trademark program, Reset Detox, which is a comprehensive and holistic approach to reset one's metabolism. From 1997 to 2000, he served as medical officer in the Korean military. His clinical career began in 2001 when Dr. Lee established the first Kyunghee Acupuncture Wellness Clinic in Seoul, South Korea. Started as one clinic, Acupuncture Wellness grew to 10 branches that now cover key parts in South Korea. As he gathered many years of clinical experience, he developed a groundbreaking branch of acupuncture, Vertex Synchronizing Technique, VST Acupuncture. VST Acupuncture has redefined non-invasive treatments for musculoskeletal disorders and has been administered in over 100,000 treatments. Aside from his clinical practice, Dr. Lee has been able to raise awareness of Korean medicine and its benefit, speaking internationally. And then from the Acupuncture Wellness Center on VST Acupuncture, about VST Acupuncture, the goal of treatments is to restore biomechanical balance when treating musculoskeletal diseases. The underlying concepts of VST is tensegrity, tension plus integrity. The body's tensegrity is examined by three-dimensional vertex analysis that examine the body in three different planes for four major vertexes in the body, allowing us to pinpoint the source of pain. Treatments help individuals to break the vicious cycle of compensation reactions that trigger functional and structural imbalances, resolving the fundamental problem and preventing future recurrences. This is taken from his website, www.acupia.com.
Good afternoon. We're here today to talk about VST Acupuncture. VST Acupuncture was created and developed by Dr. Jonghwa Lee. Dr. Jonghwa Lee has been an acupuncturist for 15 years. For the last 10 years, he has been working on the VST acupuncture technique which he developed. He owns 4 clinics in Korea as well as the clinic here in Irvine, California. I want to welcome Dr. Jonghwa Lee to our discussion of VST acupuncture. Dr. Lee, can you explain VST acupuncture and what is VST acupuncture?
Yeah, VST acupuncture include the concept of the tensegrity, and we are trying to restore human body's natural and ideal structure, that is tensegrity. That means we are using the reference point, that is 4 reference point, that is vertex. So that is both shoulder joint and hip joint. We examine the patient's 4 vertex as a reference in the 3-dimensionally, that is sagittal, colony, and transverse plane, and we check the ROM of the patient, and we found out where is the problem is, and we trying to treat that, and then we check the range of motion instantly.
Okay, so just to explain the vertex of vertex synchronizing technique. The vertex, we measure the shoulder and then the lower back and the hips, and we do a range of motion measurements on these areas, and then you'll find restriction in certain muscles that you've identified, and then can you explain if there's a restriction in a muscle, how do you make it better? How do you increase range of motion?
Okay, for example, let's do that with the right shoulder joint. We check the patient lie on his back, and then check his external rotation and internal rotation like that. And we found out, compare both sides together and compare with the normal range of motion. And if we find there's some extreme limitation in the internal rotations. We focus on the antagonist for the internal rotation. That is the external rotators. For example, teres minors and infraspinatus. And we found out and palpate where there is a knot or the tightness and treat with a needle and release the tightness and recheck the internal rotation. We found out you can find that the increase of the range of motions.
Okay, so as I understand it, you do a range of motion test. In the case of internally rotation of the shoulder, if there's a restriction, you've identified the teres minor and the infraspinatus muscle as being an antagonist muscle. That muscle is prohibiting the full internal rotation.
Yes, right.
So you've identified it, you identify those muscles, you needle into them. What happens after you needle? Do they get more range of motion?
Yeah, of course. If you find the exact point, yeah, the patient can tell the increasing of the range of motions. Yeah, before they were restricted.
These sound pretty amazing. What are the benefits that the patient can expect? Do they get increased pain, decreased pain, or better range of motion? And how soon, in your experience, say somebody has a neck pain, do they get instant benefits, or does it take a long time to get better?
The uniqueness of the VST is we can find the result instantly. The patient and the practitioner, yeah, both can find the better range of motions and better functions. It is not only the range of motions. The increasing of the range of motion means their function was restored together.
Can you describe the types of treatments? What type of problem can VST fix? If somebody has foot pain or hand pain, TMJ, neck or shoulder, what kind of treatments does VST help? What kind of conditions?
For example, usually we apply this to the diverse musculoskeletal disease. And even more, we apply nowadays the blood pressures. For example, yeah, the patient who has high blood pressure, that means they have the increased peripheral resistance. With the VST, we restore the ideal tensegrity of the human body. That means decrease of the peripheral resistance. So the patient's heart don't need to increase the output pressures. So yeah, that is how the VST can help the high blood pressure patient also. Yeah. Of course, yeah, it can be applied every kind of wrist pain, frequent ankle sprain, or low back pain, and herniation of the disc, low back or neck area. Yeah,
I think whatever. in the regards to tensegrity, which is so important to VST, tensegrity, you look at the whole body structure.
That's right.
And if somebody has a history of ankle pain, the tensegrity gets off, and it can eventually work itself up to the neck, and then even TMJ type problems. Is that the idea of tensegrity? That
yeah, we deal with ankle sprain and TMJ problem. Yeah, we deal with those kind of disease with the view of the VST. That means the patient, yeah, who repeated the ankle sprain, that means he has more tendency of the collapse of the tensegrities. So that's why he suffer from the frequent occurrence of the ankle sprains.
So a collapse of tensegrity, you look at the whole body, from the ankle to the head, and you can measure the tensegrity and
whatever
and
the patient
them.
brings, we have to check whole body. We try to restore the trunk's frame that consists of the four vertex. They are very a good point as a reference.
Okay. Shall we do a demonstration video where we can show the audience what we do in the VST treatment room, in the examination room? Shall we?
Yeah, of course, why not?
Okay.
Go.
Video demonstrations of VST acupuncture from my capstone project will be shown soon in the upcoming video. What is VST acupuncture? VST acupuncture, founded by Dr. Jonghwa Lee, is a Korean acupuncture trigger point release technique. VST acupuncture measures range of motion across the three planes, transverse, sagittal, coronal, of the neck, shoulder, lower back, and hip to identify affected antagonist muscles. VST then utilizes trigger point acupuncture to release the antagonistic muscle to restore range of motion and give pain relief. VST acupuncture is devised and based on the scientific biomechanical aspects. In VST, tensegrity model is applied to examine and analyze the body into coronal, transversal, and sagittal planes. Treatment is focused on restoring three-dimensional balances of the shoulder, pelvic girdle, and spinal curve. Evaluations of range of motion in shoulder and hip joint, which are connecting extremities of the trunk, are performed to find restrictions of movement before and after the treatment. VST acupuncture directly stimulates and separates layers of muscle and fascia in the adhesion area to promote tension to be released. After treatment, range of motion and normal length of the muscle will be reinstated. Blood circulation is also improved at the local site. Application of VST treatments will be effective for not only pain symptoms in knees, shoulders, disc, and spinal problems, but will be a key asset to determine the biomechanic systemic cause and will also allow affirmative acupuncture treatment in any variety of musculoskeletal conditions. Although VST focuses on the myofascial aspect and biomechanical alignment, it is also in harmony with the traditional theories of meridians or channels. VST also complies very well with the concept of traditional muscular meridians and the 8 extra meridians in Oriental medicine. It is greatly influenced from the 3-foot yang muscular meridians, which reach the core area. Foot yang ming muscular meridian, channel running along the anterior body. Foot tai yang muscle meridian, channel running along the lateral body, are important in diagnosing and treating coronary and transverse plane, coronal and transverse plane problems, while the 3-foot yin muscular meridians are important in solving sagittal plane problems. VST acupuncture is relevantly designed with the physical examination and its corresponding treatment. The main purpose is emphasized in balanced normalization of all connective tissue, including the fascia and the muscle, for maintaining tensegrity of the whole body. Tensegrity structures can be ruined by adhesions in muscle or fascia layers, causing resistance in their sliding movement and by the tightness of the muscles. The agonist and antagonist muscles in VST and Korean kinetic acupuncture, and in general. Agonist muscle, muscle that initiates the action of movement of limb or body part. Antagonist muscle, muscle that counters the action of the agonist muscle and creates movement of limb or body part counter to that of the agonist. In VST acupuncture, the antagonist is identified as the shortened muscle causing the decrease in range of motion of joint or limbs. An example of the agonist-antagonist muscle is the biceps and triceps in flexion and extension of the forearm. To flex the forearm, the biceps muscle initiates the movement. The biceps muscle contracts to move the forearm. It is the agonist muscle. While the biceps is contracting, the triceps extends and relaxes to allow the full movement of joint or limb. The triceps muscle is the antagonist muscle when the forearm is flexing. To extend the forearm, the triceps muscle initiates movement. The triceps contracts to straighten the forearm. It is the agonist muscle. As the forearm straightens, the biceps muscle extends and relaxes to allow full movement. The biceps muscle is the antagonist muscle when the forearm extends. In the antagonist role, a muscle that is shortened will not allow for the full movement of joint or limb. In the above example, the biceps is shortened. If the biceps muscle is shortened due to the presence of knots, the full extension of the forearm will be limited and the patient will not be able to fully straighten their arm. Okay, so I'm going to flex my forearm. The biceps contracts to flex the forearm. The biceps is the agonist muscle. It initiates the movement, the flexion of the forearm. As it's contracting to move, the triceps must relax and lengthen itself to allow the full flexion. As I extend my arm, the triceps contracts to initiate extension of the arm. The triceps in extension is the agonist, while the biceps is the antagonist muscle, which relaxes to allow the full extension. If my triceps is short and tight with knots, I may not be able to fully flex my arm. The antagonist muscle is not allowing for the full range of motion. And therefore, we have to do the acupuncture into the antagonist muscle to relax it, lengthen it, and allow the full movement of that. So in this case, if the triceps, the antagonist is tight, I can't fully extend, and then vice versa, or flex. And then if I want to extend and my biceps is short, I cannot fully extend. I have to release the muscle to get the full range of motion. Tensegrity model. The tensegrity model was first coined by Buckminster Fuller in his explanation of spherical structures and forces maintaining stability of structures. He explored these ideas through studies of the close packing of spheres and tensile and compressive stabilization models, noting that tension and compression are not opposites, but rather complements that can be found together. When the two forces are harmonious, continuous pull is balanced by equally discontinuous pushing forces. This synergy between compression and tension is what Fuller calls tensegrity, a system that stabilizes itself mechanically because of the ways in which tensional and compressive forces are distributed and balanced within the structure. On an anatomical level, the human body provides a good example of a pre-stressed tensegrity structure. Bones act as struts, resisting the pull of tensile muscles, tendons, and ligaments. Moreover, the stability of the shape of the body or its stiffness of the body is a function of the tone or pre-stress of its muscles. As Inger puts it, we are 206 compression-resistant bones that are pulled up against the forces of gravity and stabilized through a connection with a continuous series of tensile tendons, muscles, and ligaments. This is a picture, is an example of a tensegrity model of the human structure. And then the tensegrity model and the shortened muscle due to knots. A shortened muscle with knots causes increased stress and pressure upon the tendons and supporting structures that are attached to the shortened muscle. Dr. Choi, in his explanation of kinetic acupuncture, implies that uneven muscle tension to the sides of the spine causes the spine to pull to the side with the shortened contracted muscle, which is exerting higher tension. When we treat a patient's back pain, we do not work directly on the spine, but rather on the muscles attached to it. By using acupuncture, we can balance the tension of muscles and eventually obtain the proper stance of the spine. Like a chain reaction of events, an imbalance in one area can spread to other areas over the whole body. A patient with a history of ankle or foot injury could develop neck or TMJ problems as balance has shifted and the forces of tensegrity have rebalanced from the ankles to the knees, hips, back to the neck and shoulders. In such cases where tensegrity has shifted, we will see evidence of imbalance through the difference in extremity length in the coronal plane analysis, pelvic and shoulder joint external and internal rotation differences in the transverse plane analysis, and curvature of the vertebrae in the sagittal plane analysis. For purposes of this VST study, we will be studying the vertexes of the neck and the lower back and hip. Now, VST has applications across the entire body, but again, we will be just talking about the neck vertexes and the muscles of the neck and shoulder and the hips. So the neck and shoulder vertex includes the muscles of the neck and shoulder, which are tested for imbalances using range of motion test and length measurements. The muscles of the neck and shoulder vertex for the purposes of this article are latissimus dorsi, trapezius, infraspinatus, supraspinatus, teres minor, teres major, and levator scapula. Identification of the antagonist muscle for neck and shoulder pain in VST acupuncture. For neck and shoulder pain patients, we identify differences in tensegrity and the infected antagonist muscle through the coronal plane analysis of measuring arm length differences and transverse plane analysis of internal rotation and external rotation of the shoulders. Through this analysis, we will be able to target the affected muscle tissues. If there is a difference in arm length at the coronal plane, we thus identify as the latissimus dorsi and teres major muscle on the shortened side, which are contracted and pulling the arm downward. In this case, the latissimus dorsi and teres major muscles are the antagonist muscles. For shoulder joint testing in the transverse plane, internal range of motion restriction of the shoulder is correlated to the antagonist muscle of infraspinatus and teres minor of the affected side. For external rotation, restriction of shoulder antagonist muscle is the subscapularis. Limitations of range of motion to the lateral rotation and bending of the head indicate restriction of the trapezius and levator scapula muscles, with the possible involvement of the sternocleidomastoid and scalene muscles. Per the analysis from coronal and transverse analysis, we will have identified the effective antagonist muscles that are limiting the range of motion. It is these muscles that are contracted and shortened and likely to have trigger points. We treat thus by using acupuncture and trigger point acupuncture to release the muscle trigger point. For the lower back, the hip and the lower back vertex of VST acupuncture, the agonist antagonist muscles in VST, every movement in the body has an agonist muscle, a muscle initiating the action of movement, and an antagonist muscle, a muscle countering the action of the movement. In VST acupuncture, we seek to identify and treat the antagonist muscle, which is the muscle that is shortened and restricting full range of motion of the limb or body part being moved. Identification of the antagonist muscle for low back pain in VST. For the lower back pain patients, we identify differences in tensegrity and the affected antagonist muscles using coronal plane analysis of measuring leg length differences and transverse plane analysis of internal rotation of the hips. Through this through this analysis, we will be able to target the affected muscle tissues. If there is a difference in leg length at the coronal plane, we thus identify it as a gluteus maximus muscle on the shortened side is contracted and pulling the pelvis downward, barring any structural differences in limb length. In this case, the gluteus muscle is the antagonist, preventing the hip from its normal range of motion. In the coronal plane, we find restriction in the lateral bending of the trunk. Then the identified antagonist muscle is quadratus lumborum to the affected side. For hip joint testing in the transverse plane, internal rotation restriction of the hips is correlated to the antagonist muscle tensor fasciae latae, gluteus medius, and piriformis muscles of the affected sides. For external rotation, the antagonist muscles are oblique, abdominis, sartorius, and psoas. For analysis from the coronal and transverse analysis, we will have identified the affected antagonist muscles that are limiting the range of motion. It is these muscles that are contracted and shortened and likely to have trigger points. We treat thus by using the acupuncture and or with trigger point acupuncture to release the muscle trigger point, along with VST preeminent traditional acupuncture locations and points are also used, and that's an important point, especially for lower back, and both the neck and the lower back. We do traditional acupuncture points as well, especially for the lower back, along the urinary bladder, the two lines on the lumbar vertebrae, the numbers 1 through 5, and the sacral. We do the points on the urinary bladder line, as well as gallbladder 31, and then we do a lot of ashi point acupuncture along these very thick, big muscles of the gluteus area. So this one on the lower back, we do a lot. On the neck and shoulder, we do a lot of traditional acupuncture points, which correspond with the trigger points, small intestine channel, gallbladder 20, 21, and also points on the urinary bladder. So we do also traditional acupuncture points, which sometimes correspond with the trigger point acupuncture. This picture shows the needle location that we are going to use with VST acupuncture when we identify a shortened muscle through range of motion testing. So, for instance, on lateral bending or lateral rotation, if we find a restricted muscle, it's going to be either the trapezius or levator scapula. And you'll see in the picture that trapezius is indicated by the number 1 and the levator scapula is number 2. A needling technique for the acupuncturist is with the trapezius, you can grab the muscle between your fingers, the 2 forefingers and the thumb, and needle between your fingers. And so long as you're needling between the fingers and holding the muscle between the fingers, you will not have a pneumothorax accident because you can grab it with your fingers and needle between the fingers. With the levator scapula, you're going to start to, with all the rest of the points, you want to rely on your acupuncture needling training in regards to the depth of the needle and the direction of the needle. So, for instance, with the levator scapula, this is number 2. It's located in the upper medial scapula area, and we needle in a perpendicular oblique angle into that upper corner, into the direction of the scapula. Now, we can also use traditional acupuncture points along the urinary bladder lines, urinary bladder 12, 13, 14, 15, and then the outer lines, which you will do also lateral oblique, urinary bladder 41, 42, 43. So you do oblique or perpendicular. So for the neck rotation, or I'm sorry, lateral bending and rotation restriction, we identify restricted trapezius with the knots, and we get a lot of muscle twitching on the trapezius. This muscle, when somebody comes in with neck pain, I want to say 100% of the time, you're going to get a muscle twitch response somewhere along that muscle, the trapezius. That's like the major twitch muscle. So, and also like just as a general rule, any kind of pain, tension, headaches coming from the back of the neck that radiate to the front very well are caused by tight traps, and you get really good results by releasing these muscles. Okay, so then moving on, supraspinatus, infraspinatus, teres minor. These are 3 of the 4 shoulder rotator cuff muscles. So when we do the internal, external range of motion testing, we will identify these muscles. On the infraspinatus, on number 4, that's a lot of kind of perpendicular. You can, you're needling on top of the scapula, so there's no danger of pneumothorax with that. We get tons of twitch responses on the infraspinatus, teres minor. with the arm length difference, with the coronal range of motion testing, we measure the arm length, and number 6 is the teres major. Is the teres. I'm sorry, number 6 is the teres major, and it's done with coronal testing arm length difference. This one, exactly like the trapezius, you grab the muscle between your fingers and your thumb, and you're going to needle between the muscle between your fingers. And when you measure the arm length difference, you'll get a twitch response. I do not retain the needles on that one, but I will retain the needles on all these other trigger point needles. That's my technique. I will retain the needles. I'll use additional acupuncture points along the urinary bladder line. I'll use GB20 up at the base of the neck, and I can retain the needles from 5 to 10 or 20 minutes or 25 minutes or longer under a heat lamp. We love the warmth. So yeah, also use traditional acupuncture technique. So I'm going to be showing this picture when we identify the range of motion testing. You'll see this picture on the associated with the range of motion testing. This is the neck range of motion analysis. This is cervical forward flexion and cervical neck extension. For the purposes of our study, we used an inclinometer that measured the range of motion. So we're going to give you the range of motion, what is considered normal range of motion for each of these range of motion exams. So cervical forward flexion, it's a sagittal plane analysis. Normal range of motion for forward flexion is 50 degrees. For cervical neck extension, sagittal plane analysis, the normal range of motion is 60 degrees. In the cervical neck extension and flexion, the primary affected muscles are suboccipitals with corresponding acupuncture points due 15, 16, urinary bladder 10, sternocleidomastoid with corresponding acupoints large intestine 16, 17, 18, and the upper trapezius corresponding with acupoints GB21. Now, we would find restriction with the trapezius and levator scapula, especially on forward flexion. So we would be doing trigger point releasing techniques on the trapezius and the levator scapula muscles. Next is lateral bending to the left and right. This is also coronal frontal analysis. The normal range of motion of lateral bending is 45 degrees, and then neck rotation to the left and the right, another coronal frontal analysis. Normal range of motion is 80 degrees. In the cervical lateral bending and rotation and flexion, the primary affected muscles are, well, the agonist muscle is the upper trapezius, scalenes, and levator scapula. They contract to initiate the movement of lateral bending and neck rotation, while the antagonist muscle is the same muscles, it's just on the opposite side, the contralateral, upper trapezius, scalenes, and levator scapula. So those would be the muscles to release for restriction of lateral bending and lateral neck rotation. The shoulder range of motion, we move on to the rotator cuffs. So external range of motion, you'll see my arms are held out to the side at about a 90-degree angle, and we just move them up and down. So external rotation, which is a transverse plane analysis, normal range of motion is 90 degrees. Normal range of motion, the arms should reach back to touch the exam table. If there is restricted range of motion, the latissimus dorsi, teres major, subscapularis, anterior deltoid, and pectoralis minor are the affected antagonist muscles. I'm going to show you how to needle the subscapularis muscle in just a moment with trigger points. But in general, urinary bladder points 41 to 43 will be the chosen. For pectoralis minus, trigger point surrounding lung 2 is chosen. So you'll see I have a slight restriction in this picture on my external rotation where my arm is not quite touching the table. So that's maybe an 85-degree angle. So again, the agonist muscle, posterior deltoid infraspinatus, teres minor, but the antagonist, which is restricting that range of motion, is latissimus dorsi, teres major, subscapularis, anterior deltoid. On the internal range of motion, you'll see the arms are bending down, again held out at about 90 degrees, but internal range of motion, transverse plane analysis, normal range of motion is 90 degrees. The arm should reach forward to touch the exam table. If there is restricted range of motion, the posterior deltoid, infraspinatus, teres minor are the affected antagonist muscles. Trigger points in the area of acupuncture points, small intestine 9 and 11 are selected. Definitely in this case, in the picture, you will see I have restricted internal rotation of my shoulders. So I should be needling my infraspinatus and teres minor. They are restricting that range of motion as well as the posterior deltoid. So I need to do some releasing of that in this picture. Onwards now to the arm length, coronal plane analysis. If one arm is shorter than the other, the latissimus dorsi and the teres major muscles are restricting the full range of motion. Use trigger point acupuncture. Use trigger point acupuncture to this muscle in the area of acupuncture points gallbladder 22 and 23. So in this picture, my arm length looks different. Now, please note, this should be done when the patient's lying on an exam table. The practitioner will stand and bring the arms forward with their fingers pointing forward and located exactly on the midline of the head. That's how you want to measure, and you will see the arm length difference. So again, if there's a short arm length, then you need to release. I mostly do the teres major muscle releasing, and that's the one number 6 on the graph where you can grab the muscle between your fingers and needle, and you can move up and down the whole teres major and needle between your fingers, and I do not retain the needles on that technique. Shoulder abduction, aptly scratch test. Prime mover is deltoid and supraspinatus, and the affected antagonist muscle is latissimus dorsi and pectoralis minor. This is the special way to needle the subscapularis muscle in cases of external rotation restriction of the shoulders. So what we do is we bring the patient's arm back and behind their back, and what this it'll wing the medial scapula up. So by bringing the arm behind the back, the wing will fan out. The scapula wing will fan up and out, which will allow us access into the subscapularis muscle. Now, we are needling perpendicular, oblique, pointing the direction in the scapular wall, and we can go uh, as deep as 1.5 chun. So this is a way to needle the subscapularis muscle, and you can work your way up and down the medial side of the fanned out scapula. We do not retain the needles on this one. This is just a quick needle technique, and we don't retain. So this is in cases of restricted external rotation of the shoulder. And the patient will also indicate a lot of times they'll indicate like there is a problem. They'll feel the problem is under the scapula. They point, they want to dig at it, and they feel the problem's under the scapula. Well, that's a way to do it, but rely on your acupuncture training for proper needling technique, which is going pretty much perpendicular under the scapula, in the direction of the scapula wall. Okay, VST acupuncture for the lower back and hip range of motion analysis. For the hip, internal range of motion, this is a transverse plane analysis. The normal range of motion is 40 degrees. So you'll see in the picture, my right leg is internally rotated, and it looks about 40 degrees. There is a restriction on my left leg. I'm not nearly able to go as far as the 40-degree as on my right side. So if there is restricted range of motion for internal rotation of the hips, the gluteus medius, piriformis, gemellus superior and inferior, obturator internus and externus, quadratus femoris, iliopsoas muscles are affected. Antagonist muscles. Use trigger points on the acupuncture points in the area of gallbladder 29 and 30. So the agonist muscles which initiate that motion are the adductor groups on the lateral side of the hip and tensor fasciae latae on the lateral side of the hip, while the antagonist, which is the restricting muscles, which needs to be needled in case of restricted range of motion, is the piriformis muscle, gemellus superior and inferior, obturatus, quadratus femoral, and iliopsoas. In this case, I'm just doing a lot of piriformis work, which is the mid to lower buttock area. And of course, this overlaps with the glutes. So we are doing these are the deepest needle points. We can do Tuchun acupuncture in the piriformis region, which we will discuss in more detail on the Kinetic Acupuncture lecture for piriformis syndrome. There's a lot of overlap here on the glutes and the piriformis. So if it's solely just a piriformis problem, I'll do local on the piriformis, but generally there's all kinds of general lower back pain complaint as well. So we just do a very comprehensive lower back treatment where we are doing the urinary bladder points along the spine, as well as GB30 and many points covering the glutes and the piriformis. And then for external rotation, this range of motion test is also called Faber test, standing for F forward, A abduction, BER external rotation. So this is a transverse plane analysis. Normal range of motion is 45 degrees. Again, this is forward abduction and external rotation of the hip. This is primarily external rotation of the hip. If there is restricted range of motion of external range of motion, the oblique, abdominal, sartorius, and the psoas muscle are the affected antagonist muscles. So psoas muscle in particular, we do with waves of stretching and with the TLT technique we'll discuss in kinetic acupuncture. Use trigger point acupuncture in the areas of spleen 15, 14, stomach 31, and GB 26. So these are done on the frontal areas. Now I don't do that for these because I'm mostly stretching this area here, especially on this psoas muscle. But the antagonist is the adductor group muscles, tensor fasciae latae, which we do a lot of. You'll see that in the kinetic acupuncture as well, the tensor fasciae latae, the external rotation, and the hip. So we will cover that in kinetic acupuncture lecture. The leg length difference, coronal plane analysis. During the leg length difference test, the practitioner should also view the level of the hips and pelvic girdle. If one leg is shorter, the gluteus muscle is contracted, and the level of the buttocks on the shortened side will be higher than the longer leg length. So you look at the leg length and you'll see one ankle, and there are always going to be minor differences in leg length. So you'll see, like, you can grab your thumb on the point of the ankle and look at the point of the ankle when measuring the leg length difference, and you'll see one ankle may be shorter or higher up. And then you look at the glutes or the buttock area, and you'll see the shortened side will have a raised, irregular buttock area on that side. So we need to release. In those cases, we use the trigger point acupuncture gallbladder 30, and these are the glutes we are releasing. The gluteus maximus muscles contracted. So again, this falls in line with generalized lower back pain, where we're also doing traditional acupuncture. You can go with the glutes, the most thick muscle in the body. You can do 2 chun needles or greater. A lot of practitioners use even deeper needles for those. But leg length difference is primarily a glute difference accompanied by lower back pain. And now we also do with kinetic acupuncture, you will see our decompression stretches where we stretch the lower back muscles, and we can get the pelvic even in many different ways. Okay, so the lateral bending, which is a coronal frontal plane analysis, normal range of motion is 25 degrees. In this case, the affected antagonist muscle is the quadratus lumborum, which I will show you with our kinetic acupuncture therapeutic lumbar technique, TLT, where we can needle into the quadratus lumborum muscle to release that. So these are the range of motion analysis for the neck, shoulder, hips, and lower back. I'm going to show you next the video from the capstone study of VST acupuncture, where you'll see us doing these range of motion exams, and then later you'll see Dr. Lee come in and do the acupuncture needling to release the identified short muscles that we identified through range of motion analysis.
Welcome to the VST research team. The VST research is a coordinated project between Emperor's College doctoral program students and Dr. Jonghwa Lee. Together, we're conducting the VST research. We're going to go through the examination procedure. We're going to go through the treatment procedure of VST acupuncture. So we will begin by doing the measurements of the neck, the head motion. We'll do shoulder range of motion, hips range of motion. And we'll do arm length measurement and leg length measurements. So why don't we begin with the
Sure.
head?
In the sitting position or standing position?
Do it standing.
Okay,
standing.
standing positions.
If you have any comments you want to add, just go ahead.
Okay, I'll check the range of motion of the neck. Okay, don't move your shoulder and just flex your neck forward. 31.
31.
Okay, backward. Don't move your shoulder and backward. 40.
Okay. Next, we'll do lateral bending of the head.
Okay. Left lateral. 32. Right. 26. Okay, I'll check your range of motion of your back.
This is lateral bending of the lumbar and lower back region.
Okay, left.
Okay.
Right. 22.
22. Okay. Next, we'll do lumbar flexion.
Okay, don't bend your knee, just flex your lower back. One oh five.
Okay.
Okay.
Next, we'll do lumbar extension.
Backward. Don't bend your knee. 25.
25.
My
Okay.
neck.
Yeah.
Okay.
Go ahead and lie down face up, please. This is the VST Vertex of the shoulder measurements now. We're going to do internal and external range of motion on the shoulders.
시계 풀으셔. 뒤에서. 72 for external.
Okay, 72. 75 on the right side.
Right side. Left side is a 72.
External.
That was external rotation measurement. Next we're going to do internal rotation.
Okay, go. 이게 움직이면 그렇게 해요. 처음에 이렇게 시작합니다. (92) for internal.
And 83 on the left.
Right.
83, 92. Okay. If you can lie face down, please.
Wait.
Oh, sorry.
External.
Okay.
보시고
Straight.
아시면서. 네, 오른쪽 같아요.
Next we're going to do.
Do I do this?
Next we're going to measure external.
Actually, I forgot. I thought I had to put my foot together.
며칠을
Next we're going to do external rotation of the hips. And this we measure in
I just
centimeters.
want to give you a hard time.
And I just want to make a point while we're doing this. We're doing our measurements in degrees using an inclinometer. We're measuring the external rotation by centimeters.
21.2
Okay.
for left. 다른 거예요? 이렇게 될까?
지금 이것도 아파. 이쪽 엉치가 아파.
이게 좀 심한데? 안 잡아.
구두를 하도 높은 걸 신고.
25.2.
25.2. Okay, can you lie
Right.
face down next?
Sure.
Can you do the arm length test? Because I can't see. I can't get that nice. Next, we're going to measure the difference in arm length.
Yeah, try to.
We're going to measure in centimeters.
Yeah, relax. Gonna push up. Okay.
One.
Okay, which side was greater?
Right side, left side.
Left side.
Left side's
Lower.
greater by 0.1 centimeter? or
1 centimeter.
1 centimeter.
1
Okay.
centimeter.
Okay, and we did the internal.
Yeah.
Next, we didn't do the internal.
internal.
Okay. Next, we're going to do the internal rotation of the hips. Go ahead.
Okay, I'm ready.
Okay.
Thirty, 35.
35. Can you do the?
Okay, go.
Okay.
58.
58. Okay. Next.
What is the standard? 45?
Next, we're going to measure the difference in leg length. Okay. Come, you can bring the camera down here. I'm checking by the ankles, the medial malleolus, and it's pretty even. I'm going to call it even. If it's a difference, it's too small of a difference to tell. So we're going to call that even.
Even?
Yeah. And
Not ever.
okay, can you shine it on me? Okay, we've concluded the range of motion and measurements before treatment. Now we're going to bring in Dr. Jonghwa Lee. Dr. Lee will he will do his own assessment, his own measurements, and then he will treat the patient. Afterwards, we're going to remeasure the patient. So Dr. Lee.
Next VST clinical video will resume shortly. Alrighty, now that we have done the range of motion analysis and we've identified the antagonist muscles that are restricting the range of motion, it is time to do the acupuncture trigger point needling. Now, one of the phenomena very common with acupuncture trigger point needling is the muscle twitch response. It's a very good response. I explain it to my patients as if we're untying the knots out of the muscle, and the muscle is going to relax, lengthen, stretch itself. It's going to untie itself. The muscles can get tied up, entangled. The muscles get very dry and stringy, like a beef jerky like consistency. They adhere to one another. So when we get this muscle twitch response, it's a very good response. It's like it's untying itself of all that, relaxing the muscle, lengthening the muscle, separating from other tissues, increasing the circulation of blood, um, and it will relax the tension on the tendons. It's a very good response. Now, the caution is that it can be painful or uncomfortable for some patients. So when you needle, please needle with caution and with the patient's comfort level in mind. Not all the patients can stand this. You can read your patient before. They may be needle phobic. They may be very tentative, afraid, or fearful. So then you're just going to ease off and just go with the traditional acupuncture points. But you can still do traditional acupuncture on the trigger points. But just read your patient and their comfort level very carefully. So this is a paper from the books Korean Kinetic Acupuncture and VST Capstone Credentials. Neck shoulder pain, VST acupuncture, trigger points, TCT, and successful treatments. In VST acupuncture, there is a particularly satisfying event that occurs which usually predicts a successful outcome for the treatment. I am talking about the twitch response felt in the muscle trigger point needling. The most common occurrence of trigger points I find is in the trapezius for neck and shoulder, although they're in many muscles, piriformis quite frequent, but on the neck and shoulder, infraspinatus, teres minor, um, points on the deltoid. So they are very common across most points, but it's like with predictability, you can find them on the trapezius muscle almost like 100% of the time. So trigger points are evident by pain upon palpation of the muscle and restricted range of motion of lateral bending and rotation of the head. When I begin to needle the trapezius, I feel for the presence of trigger points. It is often surprising that with very little pressure between the fingertips, the patient will experience significant pain in the muscle. Usually the patient is caught unaware that they have pain in the muscle until it is palpated. As part of the VST acupuncture procedure, we needle into these trigger point areas to help break up and disperse the knots. The microtrauma of the acupuncture causes an increase in blood flow to the tissue, thereby opening up the channels, rehydrating, and softening up the tissue. But most fascinating is the twitch response. When done correctly, the acupuncture to the trigger point will facilitate an involuntary muscle twitch. This twitch can be felt with the palpating fingertips that are being held when you're performing the acupuncture technique. The patient will feel the twitch and sometimes it may be uncomfortable. Even though it may be uncomfortable, it is an encouraging sign. The muscle twitch helps to shake out the knot in the muscle, which leads to lengthening, softening, and relaxation of the tissue. Getting a muscle twitch through trigger point needling will usually indicate a significant decrease in pain and increase in range of motion immediately following the treatment. As a word of caution, too aggressive of needling may cause a stiffening of the muscle or residual pain from the needles that may last a few days. I always follow up our neck and shoulder VST treatments with a TCT therapeutic cervical technique, Twina technique. We called it motion style in the kinetic acupuncture, which is a series of gentle mobilization techniques on the neck, ending with TCT number 4, which is a cranial sacral acupressure technique, where the patient's head is supported under the occiput by fingertips of the practitioner for up to several minutes. After just a few seconds, the practitioner should be able to feel the suboccipital muscles begin to melt like butter under the fingertips. This is a very relaxing treatment and has been described as getting a brain massage by one of my colleagues when we were learning it. This is a great way to finish up a neck and shoulder treatment or any general treatment at all. I will often do TCT number 4 while the needles are retained in the points on arms, legs, and torso, but never while the needles are in the head, face, neck, shoulder, or upper torso. This is a very gentle and relaxing procedure for the patient. I have learned VST under Dr. Jonghwa Lee, VST's founder, and Dr. Hyung-Suk Choi, who taught TCT. Both were professors and practitioners at Samra University's Specialty Pain and Doctoral Program.
Could you move up? Relax. Yeah, I can tell left side internal rotation of the hip joint is limited. So first of all, I will treat the external layer, that is the antagonist for the internal rotation, and gluteus medius and gluteus minimus in these areas, and then I go to the shoulder area. Yeah, okay. Right side is shorter, so I will treat the latissimus dorsi, that is antagonist for the abduction of the shoulder joint. Yeah, here. Okay, let me start. Thank you. Now I'm treating the latissimus dorsi of the right side, the shoulder side.
Oh.
Okay, and then I will recheck. Okay, yeah, they become even. Okay. Okay. And then.
Is this gluteus
medius. When you insert the needle, you can find there are some resistance. That's the area of the muscle tightened. Before inserting the needle, with the palpation, you can tell which area has more tightness. Okay. After treating, and we check the range of motion. Okay, you can see, yeah, left side rotation, they increase, so they become even.
Much better.
Yeah. Infraspinatus.
He's needling the infraspinatus. This is for internal range of motion restriction on the left shoulder.
Ooh. When I put the needle, yeah, patient and practitioner can feel the twitching sensation of the target muscle. Oh, yeah, there's a big one. So they limited the range of motions. Yeah, probably the patient suffer from severe neck and shoulder pain. Okay. And then she also has a problem in the subscapularis, then limited external rotation of this side. So
Twitch.
there are a lot of twitching in this area.
He's getting a lot of twitch response. That's a good indication. It's a positive indication.
Yeah, that's a good indication. After treatment, yeah, you can find out the more increasing of the range of motion. This is teres minor.
Teres minor is also an antagonist of the internal rotation
Yes, right.
of the shoulder.
원래 문제는.
우와, 되게 오랫동안 아프셨대.
너무 괜찮았어. Okay, let's start. Okay, 여기 좀 가려주시고요. 여기다가 subscapularis를 심어놓으시겠습니다. Right now, yeah, I'm going to treat the subscapularis. They are the antagonist of the external rotator.
Left shoulder.
Sorry, of the left shoulder. The subscapularis is the antagonist muscle of external rotation.
Okay. Let's check it.
지금 말해도 돼요?
네.
So this is
평상시에는요. Normally my right shoulder, I have more pain on right shoulder, but I guess
okay.
Check it out.
that's right. And I have neck pain.
Okay.
I should say.
With rebalancing your shoulder girdle, we can treat the root cause of your neck pain and shoulder pains. Even though you have severe pain in your neck and shoulder area, if we focusing only that side, that has more possibility we missing the root cause of your problems. With the tensority model and protocol, we treating your shoulder girdle balancing. Yeah, that is more helpful to treating the cause of your problems.
Yeah, I also have pain on my face, like underneath of
Right.
this cheekbone, and sometimes here, like itch. Kind of feel like it's itching here,
Itching sensation.
and I have a lot of headaches too.
Yeah, that makes sense because left side has more tightness than right side, so they pulling down your muscles of that area. That means to right side should be stretched, overstretched.
Okay.
Yeah, so that cause problems and pains in your right side. Even though you have patient, the patient has manifest the pain on right side, we don't have to treat this side. We can treat the cause of the problem, pain. Cause of the problem, pain. Okay. And let me check your shoulder, hip joint. Yes. Yeah, I can tell left side goes much easier compared to the right side. That means the oblique of the right side restrict the. Can I have the needle?
Her right side external rotation of the hips is restricted, so Dr. Lee will be needling into the abdominal oblique muscle
Right.
on the right side.
Some area they tight too much. The needle has hard time to get through. First, we will treat the oblique muscle, and then we check the RM. And yeah, I can tell they goes much more. And one more, and check the psoas muscle together. compare both sides, and I can tell the right side psoas muscle is very tight. So I will release the right psoas muscle. Yeah, could you straighten your? Usually, just with massaging in deep muscle, you can releasing that area. Okay. In some case, we need to insert needle to the psoas muscle directly. For that, yeah, let the patient lie on her left side down. Yeah, could you face there? Her left side down. Yeah, could you face there?
이쪽으로 보시고 옆으로 보고요.
And here is the iliac crest, and here is the 12 sleeve. From this space, we can reach the psoas muscle. Can you feel the soreness?
Yes. Oh.
Okay. Okay, let's turn over, lie on your back again.
Can I say something, Dr. Lee?
Yeah, of course.
Okay. After playing golf, and I had a pain here.
On your side, yeah.
Yeah, right here.
Yeah.
Not the back, but like side
Yeah,
here.
you're right.
Right here. Especially when I sit down for like an hour or so, and I get up, I have so much pain. I don't have pain normally, but when I'm sitting down for a long period of time, when I get up, when I just step on the floor, I got really get up.
Yeah. Let's start from the unbalancing of your pelvic area. So, when using hip joint as a reference, so we can find out how your level of your pelvic girdle. So right now I'm trying to rebalancing your pelvic girdle. So after that, the both sides of your flank area, they can get ideal tensions. In many cases, when you're healthy, even though you're playing golf and whatever you do, that cause no problems. But unbalanced condition, yeah, some activities, for example, golf or soccer, usually you don't do. If you do something rare, they cause problems, symptoms. So right now, I will recheck. Okay.
I feel so much better already.
Almost they become even. And let's bend again, and let me check the left side. This side psoas muscle is normal, so they feel no tightness. They are relaxed and they are good condition. Only the right side has a problem. So if you suffer from the left side, we don't have to treat left side. Only treating the restricted area, they become relieved. The symptom will be relieved. Okay, everything is done, and you will recheck the range of motions and then compare the result.
Okay.
Thank you, Dr. Lee.
Thank you, Dr. Lee.
Thank you, Dr. Lee.
Did I ask too many questions?
The patient has had her treatment, and now we're going to remeasure everything again to see if there's a difference before and after the treatment.
Okay.
We'll start with the shoulder measurements while she's on her back. This is internal rotation of the left side. That's 84. Sure, all right.
Right, 96.
Wow. I feel so much better, everybody.
That's
Aren't
good.
you glad you had the procedure done?
My eyes like it popped.
Yeah. It's $90 value.
I think we want.
Okay, go.
52.
Cervical flexion.
58.
Okay.
Okay, lateral left. 37.
Okay.
Lateral right. 31. Okay, lateral left. 23. Lateral right. 20. Okay, full flexions. Don't bend your knee. 106.
She's very flexible.
Schedule. Okay. By the way, our patient, she had neck pain, and this on the VAS scale, this is the before treatment on the VAS scale that the patient marked as how bad is her neck pain. This is the most worst pain at 100%. This is no pain at 0%. This is exactly 10 centimeters long. So you can see where she marked here. It's closer to over here, which is that. Now we're going to ask her to do the pain. Can you mark now, where is your neck pain right now? This being no pain and this being the most pain. Where in the chart is your neck pain?
I have actually I don't no pain at all for now.
Here, which is that. Now we're going to ask her to do the pain after. Before, after. Cervical flexion 31, after 58 degrees. Cervical extension 40 degrees, before, after 48. Lateral bending on the right side 26 degrees. Lateral bending on the after the treatment 31, 32 on the lateral left side 37. That's kind of not going to be legible. And the lumbar flexion bending forward is negligible difference, 105, 106 before, after. Lumbar extension, 25 degrees, negligible difference on lateral and left side. Internal rotation of the hips. This is the left side. Internal rotation was 35 degrees. After the treatment, left side internal rotation of the hips was 52 degrees. There's just a negligible difference on the right side.
It's really balanced after the treatment. 52 and 56, the left and right is really balanced after the treatment.
There's a balance between the two here. And then external rotation of the hips. Before it was 21.2 centimeters on the left side. After, actually, the difference was 24.3. We're measuring how high the hip is from the table. So the lesser the centimeters, the more flexibility. So there was actually a difference, a greater difference after the treatment than before. On the right side, there's a slight improvement from 25.2 to 24.2. So this is the
conclusion. Yeah.
This is the protocol that the VST research team between Emperor's College and Dr. Jonghwa Lee. This was the procedure for measuring our patients. We had over 20 patients, and we will be gathering the statistics next. This video is for information purposes. Any acupuncturists or healthcare practitioners are welcome to contact Dr. Lee or any of the research team from Emperor's College. Thank you very much.
Okay, good job, Evan. Thank you.
Okay.
Thank you, everybody. Thank you, Dr. Lee, for treatment. I feel so much better. Thank you.
Photographer is Young Jun Yun.
Any final words, Dr. Lee? Why don't you talk with the patient?
Thanks to you, we can have a time to make a more solid protocol of the VST. And thank you for all of your staff. Thank you.
Thank you, Dr. Lee.
Dr. Lee.
앵글만 잡으면 돼요.
So we just have to smile. It's all good.
Okay, good.
Smile, smile, smile.
Okay, very good.
저도 하나만 좀.